Hello, everyone, and welcome to this month's Public Health Roundtable discussion. We're excited every month for the discussion and for the topic, but especially this month. We've been chatting a little bit, getting kind of backstage, getting ready, and this is going to be a really good discussion. So I encourage you right now, if you're watching us live or even if you're watching the replay, go ahead and reshare this post because that'll serve it up to your network. I think people are going to want to join in on this conversation. We invite you to join us in the comments if you're with us live or watching the replay. And if we do share this on our podcast. So if you're listening to this on the podcast, we'll be sharing how to join the conversation with you as well. So we'll start with introductions. Again, this is the Public Health Roundtable discussion. Every month, the first Wednesday of every month, we show up live on LinkedIn with a slightly different panel. We rotate within our small group of professionals and consultants to discuss topics of interest. So this month is National Minority Mental Health Awareness Month. And I'm going to be sharing with you a little bit more about that because I went a little bit of a rabbit trail, kind of searching and preparing for the topic. So I'll share a little bit more about what that means and how we even got here. My name is Dr. Charlotte Huntley, and I'm the CEO of Dr. C.H. Huntley LLC, which is a consulting firm. We support large nonprofit organizations, specifically BIPOC organizations. So occasionally government agencies as well, but they are serving and very genuinely interested in serving and supporting BIPOC communities. So that is Black, Indigenous, and people of color. Very passionate about this particular demographic. So it kind of adds to my excitement for this topic. But we essentially help them communicate their health information to the communities that they serve. This is incredibly important in terms of making sure that people understand their data and we're not using jargon so that they feel like they're talking over their heads or we're telling them what they need to do, but yet approaching in a way that we're helping them to understand this data and we're learning as much as we're teaching and giving. We're often invited to support tribal organizations and we're just always excited to serve. I'm excited to lead this panel today. I'm going to kind of pass the mic around and have you meet our guests. We'll go over to Ericka next.
Hello, everyone. Thank you so much for having me today. I am Ericka Horne. I am the CEO and founder of Advocacy Consulting. And with my business, we get the opportunity to work with nonprofit organizations, faith-based organizations, and a lot of youth mentoring organizations. And we provide health events, help them and support them with the health events that they're planning, whether it's a health fair or a panel discussion, or just bringing in health awareness and health education to the communities that they serve. So it's really an honor to be here. I'm really excited, especially about our topic, being a woman of color and talking about mental health. Also, as a mental health first aid instructor, being able to provide those services to the different organizations that I serve as well. So really excited to be here. Can't wait for us to continue the conversation.
Hello, my name is LaShonda Richardson. I am the CEO and founder of Emerge Public Health and Community Development. Emerge's mission is to educate, to motivate, empower, restore, grow, and evolve. And Emerge works with individuals, with businesses, and organizations to provide public health education and also to ensure that they have the resources that they need to make informed decisions about their health and wellness. Emerge also hosts, plans, and facilitates community events that provides that education resources for the communities and organizations that we serve. I am super excited to be here today, and I'm excited about continuing the conversation.
Hi, everyone. It's so wonderful to meet you. My name is Andrea Lowe, and I am a partner and collaborator at Social Impact Studio Consulting, where we work with primarily small to medium-sized nonprofit and government agencies in the health and human services space to help increase their impact when it comes to strategic planning, policy development, and strategic program reviews. Our work is really focused on community-driven, community engaged, and community-led planning and policy development. And so we're really excited to be here today because when it comes to minority mental health, when I look at it, I think of the spaces that we create as well when we're doing our work. So looking forward to the discussion.
So I'm going to just take a moment. I do have a question for our panel that's going to, kind of jumpstart the discussion. But I thought it would be great to put a little bit of background to this awareness month. It was a little bit of a surprise to me as I was searching. This was earlier in the year and we realized it. I don't know, I guess I've stumbled over this in the past, but let me start with sharing the actual full name of the holiday, or the awareness month, is named after B.B. Moore Campbell National Minority Health or Mental Health Awareness Month. So I went down a rabbit trail I wanted to know more about this amazing woman that I kept getting glimpses of, but I found a short bio that I'd like to read, and then also a quote. So B.B. Moore Campbell was an American author, journalist, teacher, and mental health advocate who worked tirelessly to shed light on mental health needs of Black community and other underrepresented communities. She struggled to support her daughter, who battled with mental illness, and really a system that prevented her daughter from getting help that she needed, the support that she needed. So she founded NAMI Inglewood in a predominantly Black neighborhood to create a space that was safe for Black people to talk about mental health concerns. So that safe space is critical and important. And I personally know what that is. And I almost kind of forget that some people don't have to worry about a safe space, but it's like, that's really important. So that personally touches me to hear that in this context. So throughout her time as an advocate, Ms. Campbell made her way to DC. So on June 2nd of 2008, Congress formally recognized B.B. Moore Campbell's National Minority Mental Health Awareness Month to bring awareness to the unique struggles that underrepresented groups face in regard to mental illness in the U.S. So here's the quote that I'd like to read to you all. While everyone, all colors, everyone is affected by stigma. No one wants to say, I'm not in control of my mind. No one wants to say, the person I love is not in control of their mind. But people of color really don't want to say it because we already feel stigmatized by virtue of skin color or eye shape or accent. And we don't want any more reasons for anyone to say, you're not good enough. That's really strong. That really resonates. And I think it really helps connect with, for me, it kind of reminds me of, like I said earlier, why I really focus on BIPOC communities and really wanting to serve and support. With that in mind, that's a little bit of background, a little context. My question for each of you: how are you leading and engaging in minority mental health awareness conversations with communities that you serve? Now, I'm not talking, maybe specifically just this month, but in general, because I think we're addressing this all the time. This month is about raising awareness. But again, how are you leading and engaging in minority mental health awareness conversations with communities that you serve? And we'll go in the same order as introductions. Let's start with Ericka. I'd love to hear your response on this.
Thank you so much. I think that was a great question and a powerful quote that you shared. It really allows me to really think about the work that I am able to do and the different communities that I serve. I specifically can think about an opportunity where I get to share with young people. I get to share with youth about mental health. Also, like young adults, mental health first aid, do trainings for different churches and their leaders, and just making sure that people are aware of the different signs and symptoms to look for in their loved ones and the people that they're surrounded by. Sometimes, as mentioned, there's a stigma surrounding mental health, especially within the Black community. And then having already looked into how our childhood and our adverse childhood experiences can cause and lead to even different kinds of traumas that can lead to different kind of mental illnesses in adulthood. All of those things come together, compacted. It really means that there's a need for the awareness to continue to be going on. So it's not just, the month of July, we have April also for mental health awareness, but literally having conversations every time you meet with people, and just, even if it's just a simple check-in, hey, how are you doing? And like sitting and actually listening to how they respond. Like, I know I do that with my mentees. It's not just, oh, good, you're doing great, all right, talk to you later, but like a true check-in, even checking in with the clients that I serve, like, how's everything going with you? Because the work that you're doing as a nonprofit or in as a leader in faith-based organizations, you cannot pour out if you're not in a place where you're being poured into and where you're safe and in a safe space. So being able to show up for those people and allowing them that safe space that she talked about is essential. So I love that I'm able to do that. And I think it's so important, and it stems from me being able to do that for myself. So having started, going through my own therapy and my own journey of mental health is allowed me to be even more cognizant and more available and more present. So I'm grateful for the different things that have all been a part of preparing me to show up and have these conversations because they're essential. And with the stigma, we think there's a stigma, we think, oh, we can't talk about it. And especially if you're a person of color, it's like she said, it's like so much even worse. Like, oh my gosh, I really can't say something's wrong. Like they already think something's wrong. Okay, what can I do? We have to normalize the conversation. So having those conversations regularly and to reduce stigma, to demystify it, to not make it seem so, oh my gosh, there's something wrong with you. Like health is normal. Mental health is normal. Everyone has mental health. Just like we all have physical health, we all have mental health. So we all are just taking care of that in the ways that we do that. And having regular conversations, just like we may do about other health concerns, as we do our mental health is important. So normalizing those conversations is a part of what I get to do.
Yeah, absolutely agree with you. And I'm so glad you highlighted, that perspective, faith-based organizations. I grew up in the church, and I know that, in my Black family growing up, that was just we talked about almost everything else, but we didn't go there on mental health issues. That was just it just wasn't open for discussion. So I like how you bring that perspective. LaShonda, how about you? What are your thoughts? How are you leading and engaging in mental or minority mental health awareness conversations with communities that you serve?
Yes, so similarly to what Erica was saying, I think I read something about healing communities one conversation at a time. And I think that that is very important. And that is something that I do is making sure that the conversations are happening. And in those conversations, making sure that people have the tools and the resources that they need to be able to create strategies to work towards what we're talking about in those conversations, whether it be offering focus groups or some type of podcast or books or something to that nature to give people the resource that they need to be able to have the conversations and keep them open. And when we were talking about, I know we were talking about Black families and things like that, growing up, you didn't talk about what happened at home. What happened in the house stayed in the house. And so a lot of trauma, a lot of things happened that we weren't allowed to talk about. So offering that safe space and actually teaching people that it's okay to revisit those moments, because in those moments, there may have been things that happened that have transitioned over to your adulthood for things that you haven't dealt with in when you were a child. So just teaching people that it's okay to talk about those things and giving them the resources on how to be able to open up and what to say, and no judgment. I've heard several times about that safe space, but creating safe spaces for people to talk, and then just letting people know that they aren't alone. You're not the only person that may have dealt with this, and getting at least one person to share opens up for other people to feel comfortable in sharing that. So I think in doing that and creating a place where there is a cultural like a conversation that is culturally sensitive. So we're talking about mental, like I think Dr. Huntley said that there's always already some type of stigma or some type of, you already feel, and we think about imposter syndrome and all these types of things that we have to deal with, or not being able to enter into spaces as our authentic selves, and all of that. We already have that. So just making those safe spaces for people to be able to converse and doing that and providing resources because there's things like therapy for girls and therapy for women and therapy for Black men. And I think about even children now in my family and breaking those generational curses where we hold on to things that happen. So even I'm thinking about my nieces that they are 12, and even with young children, just creating that space for them to be able to talk and being a person to you're listening to hear and not listening to respond, so that you're really listening to what people are going through, because mental health doesn't have a look. You could look like you're perfectly fine and you can be dealing with something internally. So creating that safe space, making sure that people have the resources and that they know that they have that space to be able to talk and to, release whatever they're going through in their mental crisis or whatever they're going through is what I do in working with the communities and the businesses and the organizations that I work with.
It's really wonderful, LaShonda. Thank you for everything you said, and I especially like how you give a few examples, and then thinking about like your nieces that are like 12. That's a very like that when you mention the girl at 12, we all of us are like, okay, we remember that point, and that's a very complicated step on the journey of life, right? So that's great. So Andrea, same question for you. I'm looking forward to hearing your response. How are you leading and engaging in minority mental health awareness conversations with communities that you serve?
Sure. So I would say two different ways, and the first is with and through my clients, and very similar to Erica and LaShonda, creating those spaces for conversation, those spaces for consideration, and making sure everyone, really everyone, has not only a seat at the table but has a voice that's heard in some capacity and can speak to what we're creating, so that they everyone feels like, okay, yes, there's a piece of me in this. I'm bought in because you care. I think of one example of working with a client to create a procedure around some outreach work that they're doing, and just starting off with like connecting with a community-based organization that understands the culture of the area and the culture of the population, and the challenges that they're navigating, and having that briefing with everyone who's volunteering before you even get started, so that you begin to understand where people are coming from, and maybe kind of checking your own biases a little bit so that you can provide better service, is one way that I've been doing that. The second way is really around conversations that I've been able to have with leaders in the field or in other fields, in health and human services, in technology, and other business, other areas, around not forgetting who we're serving and who our communities are, and thinking about minority communities when they're developing their products, their services, how we're designing the way that our systems are set up, and the importance of really, I want to say, like almost getting out there and remembering and connecting with people who are maybe different than you, or maybe part of your community but in a different area or a different status and different financial state, that you need to remember to connect with them and talk with them about what's going on, so that you can create the change that they need to see happen, because you're in the space to be able to create that change. So that's the second way as well.
I love that. All of you provided such, rich feedback and from different perspectives and angles. This reminded me of a situation. So I mentioned earlier that we're often invited to serve and support tribal organizations, and I was invited to lead facilitate a workshop for an in-person conference gathering for tribal leaders or tribal organization leaders. So there are 12 different organizations, and it was their leaders and their plus one. So their leaders and like senior support. And I flew to New Mexico for this, and it was a little, intimidating for the room, but not so much. It's just sort of the normal level, right? But I kept wrestling with how to engage. I was invited in. I knew some of the leaders already. I had a relationship. I wasn't like brand new, but I was only outside person invited in. So I was very aware of that. And I I had a slide deck that I redid 2 times, like the day before I was presenting, and I still wasn't happy with it. So I decided I had a whole day and I was gonna, if you think about it, a slide deck kind of keeps you on track and it kind of helps you stay structured. I decided to not deal with the slide deck. I threw it out altogether. And I went in with the approach of I thought, as a leader, I know that there's always this responsibility. So I was thinking about the mental health, the capacity of the leaders in the room. So I started out by simply thinking about them and putting myself in their shoes. And I thought I shared a few stories to give them a few perspectives of, my perspective as a leader and my roles. And then I focused on them. I was like, how are you? And they were exhausted, clearly exhausted. It was day 3 of the 3 days. So I got the last day. But I focused on them and I shared a few stories and then I held space for each of them to just kind of share how they were feeling, where they were, what their biggest struggles were. And it was amazing to see how everyone sort of exhaled and relaxed into it and the conversations were just flowing. So I say all that to say, just being aware and especially when we're dealing with leaders, I prioritize their mental health and all of them were of, the BIPOC community, or they all definitely serve that community. So it's a different level of weight that they carried. But that was just another approach, is just kind of creating a space that maybe they had their notebooks ready, but I just, we're not going to do that whole thing. I could tell you 15 strategies that you could take back to work, or I could take this time and help you kind of exhale. And then, so anyway, that's a lot of good stuff shared here. We'll go around one more time because I want to give you all an opportunity to kind of heard from each other. And then I'll kind of go last with takeaways because I have like a different twist on how I want to wrap up today. But any, takeaways, final thoughts that you want to share, we'll just kind of go around. Same order. We'll start with you, Ericka.
And so I'll try to be as brief as possible. I will say that this conversation just needs to continue. I really enjoyed listening and hearing everybody's perspectives and how the way that we are all able to hold space in our communities and in our businesses and in those that we're serving in our families, however way we're holding space. But just also encouraging others to continue to make space for that, being culturally competent to those that we're serving, actually listening to hear, listening to understand, like those are key strategies and they really speak to the work that we're able to do. And I'm just really excited that as we continue to have these conversations and normalize the conversations around mental health, it'll be more normalized and, prayerfully we'll start seeing, statistics of illnesses and diseases and other situations begin to decrease as we're becoming a more healthy people overall. And that includes our mental health.
Yeah, very well said. I agree with you on that. What about you, LaShonda? What are your takeaways or final thoughts?
I definitely agree with continuing the conversation and also just sharing your experiences. I know sometimes it's hard when we've gone through things, but I think that when we share, we give the opportunity for people to know that it's okay and they aren't alone. So just sharing things that you've gone through, sharing things that have helped you, because that's how we begin to help each other. So I think that when we create those spaces where we can be open and honest, is how we begin to allow people to know that it's okay. It's okay to not be okay, but there's a route to getting better. So that's what I would say to us, to continue the conversation and to share our experiences so that we can grow and get better together.
Absolutely agree as well. And Andrea, what about you?
Sure, I really appreciated this conversation. For me, I think the takeaway is just the importance of minority mental health as its own, like, I don't want to say separate, but as a part of mental health, that there's so many special considerations there, but then also just the fact that it kind of is this reminder that there's so many strategies to support mental wellness in very, very different communities. And I think we need to remember that and continue to build on that and support it. And I love, Ericka, I'm going to play off your takeaway, just that it's part of our overall health and that we need to remember that and value it as part of making us all healthy and whole.
Yeah, I love this. This has been a great conversation. I could keep going because I'm receiving so much goodness from this, and I'm hoping that others are experiencing the same. Well, first thing I want to ask you to do is, if you're watching this recording, you have all of our names right here. Make sure that you're connecting with us here on LinkedIn so that we can follow each other and grow our networks. Share in the comments for sure. And if you're listening to the podcast, don't worry, I'll make sure our names are included in links to our LinkedIn so that you can connect as well. And then I want to share the fact sheet is probably my favorite. And I haven't looked at everything in detail yet, but the fact sheet starts with BIPOC mental health myth busting. So they have basically taken about looks like six myths that we have. I could read them down, but I'll let you go get the fact sheet. But we've all heard them. But there's two I want to address here because it's come up in our conversation. And what they've done is taken the myth and then they rewrote it into affirmations. So I want to leave you with, as Ericka says, like a call to action at the end of this. So we're not just going to sit here and talk about, like, we had a great conversation, right? But I don't want to leave you just kind of like, well, what am I going to do now? We're talking about how it's been. But I feel like this is a great way to wrap up. It gives you some action items. So I'm going to just read these two, but like I said, you have access to getting the whole, the printout for yourself. So the first myth that I'm going to address is talking about my feelings and needing help is a sign of weakness. We've all heard that kind of thing. It says, I won't go into all the details of what they wrote, but that's the myth. But here's the affirmation. One is expressing my feelings and asking for help is a sign of strength, not a sign of weakness. Another one that you can use is giving and receiving support is part of a natural cycle of life. I have given support in the past, and I'm allowed to receive support in the present. I can give support again in the future. I really like that one. Some people really need that one, right? And then the second one that we absolutely touched on was what happens in the family should stay in the family. So when LaShonda said that, I thought that's exactly what this is like. I've definitely heard that. So what happens in the family should stay in the family. So instead of that, here's an affirmation. I'm gonna give you two. The first one, I'm allowed to express myself to people I feel comfortable and safe with, even if they are not my biological family. And the second one, which is touches me because I've used in this phrase of, sister by choice. I have a friend that's and we refer to each other as sisters by choice. So this second affirmation says, I'm allowed to create a chosen family that I can trust to listen when I need validation and support. So I feel like I've given you something as we wrap this up that if you're listening to this or watching this on a rush, you don't have time to dig through the fact sheet. Those are some that are very relevant to what we were talking about during this whole discussion. But the link in the comments, go to the site, put in your email address, download the toolkit, and grab this fact sheet. I really encourage you to put that to use. And they've made the affirmations really easy. And sometimes it's nice. You can put it on a little post-it note, say by your computer, your mirror in the bathroom, or on an index card, tuck it in your purse or wallet and just read it every now and then. But these are just some small steps that you can take in that right direction. So thank you all for being on the panel with me today. This has been fantastic. Thank you all for joining us in the comments and watching the replay and listening to the podcast episode. I look forward to continuing this discussion throughout this month and ongoing. It doesn't stop at this month, but I really want to hear from all of you that will have something to add to this discussion. So we're going to wrap up and close out here, but we're going to be in the comments and engaging with you. So have a fantastic day. We'll see you on the next roundtable. Bye, everyone.